For this research presentation, we'll be talking about methicillin-resistant Staphylococcus aureus, otherwise known as MRSA. So why did we decide to talk about MRSA? Well, first off, it's a very common both hospital and community-acquired bacterial infection that's beginning to cause more and more problems in our system. And then on top of that, nurses can have a really large impact in preventing the spread of such a dangerous disease. So just to give a little bit of background on MRSA, it is a gram-positive Staphylococcus aureus bacteria. Now, it normally just lives kind of on the surface of our skin, it can live in our gut, and it can even live in the nares of our nose without really causing any problems, without causing any symptoms or any true infection. But the problem begins when it starts to spread to other areas of our body. So MRSA can spread to the skin. This is one of the more famous versions of the infection you'll see. When a patient that's MRSA positive normally gets any sort of cut, the cut can then become infected and cause a really difficult to treat problem for our patients, causing all sorts of morbidity and mortality. We can also see MRSA pneumonia, which is just an infection into the respiratory tract with the MRSA bacteria, which can be even more dangerous than the skin infection, and again, really tough to treat. And then you can see different MRSA joint infections and abscesses under the skin, which again come with our own slew of complications, a lot of times requiring surgical draining, surgical debridement, and all that kind of stuff. So again, really bad for the patient to contract this disease. And what makes it so bad is that MRSA is a resistant strain of bacteria. So it's resistant to a lot of antibiotics that we use to treat ordinary staph infections, and it's resistant to especially the specific type of antibiotic called the beta-lactams. So this includes penicillin and then all the derivatives of that, so like in its name, methicillin. So this makes treatment of MRSA really, really difficult, and kind of makes the morbidity and mortality of these infections really high. So that means prevention is key, and that's what we're going to talk a lot about in this presentation. So prevention with everything from hand hygiene to inactivating contact precautions, and then things like intelligent antibiotic use all become really important in just preventing these infections because they're really dangerous once they do develop.
The quantitative article that we examined was from Barnes Jewish Hospital and Midwestern Teaching Hospital in the United States. And we examined the MRSA acquisition rates between 5 ICU units, comparing soap and water bathing to chlorhexidine gluconate bathing. And what the study found was that in the 3 ICUs with active surveillance by nose swabbing to test for MRSA, that the soap and water bathing recorded 111 cases in the almost 22,000 patient days, and that patients that were bathed in the CHG, that was a lesser number in 91 cases in around 31 patient days. So that was a good decrease. And then there were also the 5 ICUs that were surveyed with and without nasal swabbing, and that showed that the soap and water had 132 cases, as well as in 34 patient days, and the CHD was in 109 cases in around 41 patient days. So again, it decreased with the CHG bathing. And when whoever conducted the study swabbed the original basins that were used for all of these bathing protocols, and they found that there was a 95.5% decrease in bacterial growth on the bath basins when the CHG was used instead of soap and water. So you can tell that this was a very effective method of controlling MRSA acquisition. Next, the rate of MRSA acquisition also decreased, directly proportional to the data I already gave you, from 3.84 cases of MRSA to 2.63 cases of MRSA per 1,000 patient days. And patients without the CHG soap are almost 1.5 times more likely to acquire MRSA, according to this study.
So for our qualitative study, what we wanted to look at was the perceptions of nurses and reasons why they may not want to take the right precautions to prevent the spread of diseases, even though they might know the dangers that it presents. So in the survey, they asked nurses different questions about MRSA or precautions and why they don't do things to the standard. So nurses replied on the first question about taking contact precautions the proper way. They said that they're overworked and they don't have enough time throughout their day to do things, so what they do is they don't take the proper precautions to try and cut down on time and be able to get everything in a certain day. And that's very dangerous, especially in immunocompromised people, because if they don't take the proper contact precautions, then they could be spreading MRSA throughout the hospital, which is not ideal. So next, they were asked about wearing gloves and if they always wear gloves, and if not, why wouldn't they? So what they said was sometimes they wear gloves, but it's only if there's like blood or things in the area. They don't wear gloves sometimes because they don't agree that it reduces the patient-nurse relationship and doesn't provide a trusting relationship, and they're trying to build rapport with the patient, so that they often don't use gloves because they see the patients, the nurses think the patients see them as treating a disease, not a patient. So a lot of times they won't want to wear masks or wear gloves because they feel like they're not humanizing the patient enough, which provides a therapeutic relationship between the nurse and the patient. And lastly, a lot of nurses reported that the environment they work in doesn't suit proper contact precautions. So what they were saying was that if a patient has a contact precaution, a lot of times they don't have, especially in poor areas, they don't have enough equipment to fill that room, so they're going to have to take things such as blood pressure cuffs, thermometers from room to room, which could also cause the spread of diseases like MRSA. And it's not good, like we said earlier, for immunocompromised patients, but we need to start getting things such as blood pressure cuffs and things such as Dynamaps, things that you take from patients room to room usually, separate it and put in special contact precaution rooms because that could eliminate the spread of MRSA.
Okay, so recommendations from the literature that we found were before entering the room, collect all your materials so you're not going in and out, and one of the concerns was time factor. So if you collect all your items in one spot, you don't have to ungown and regown if you forget something. Double check your patient assignments. You want to make sure that your patient assignments, you're not assigned to a patient that's immunocompromised as well as has MRSA, because there's a greater chance of you contaminating and transferring the MRSA to the immunocompromised patient. Continuous education for all employees, families, and visitors on MRSA. Many people don't know what MRSA is, and if a family member has it, all they really know is that it's a skin infection. So if you can do patient teaching to families and visitors about MRSA, why the PPE is used, how to make it effective so that it's not transferred throughout the unit, and so forth, you should do that. For employees, many employees know kind of what MRSA is, but not exactly how to reduce transmission. So if you want to go, or you should have like a training session to go over how to reduce the effects of transmission of MRSA and how to properly put on PPE and how to properly wash your hands and do those types of things. A protocol in place for communication about isolation status and patient history of MRSA. So many nurses were finding that they were walking into rooms when the patient was newly admitted, and they would come back an hour later and there would be precautions on the room. So they weren't notified quickly enough that their patients had MRSA. So they were going in, touching a whole bunch of stuff, then doing other things with other patients and didn't know. So there needs to be a more efficient way of letting the nurses know or the staff know that there is a person coming with MRSA if you can. And creating a secluded area that active or potentially active MRSA patients could go. So this would mean if they came in with symptoms that you would think that they had MRSA, putting them and registering them in a secluded room so that you would reduce the transmission of MRSA on the unit and to other patients in the unit. Okay, so continuing with recommendations, wiping down surfaces with things that you normally use. So this would be your stethoscope, your scissors, pens, anything that you're going to take out of the room must be wiped down with a disinfectant or a Clorox, something to clean it so you don't spread the MRSA. Multimodal training components would be either having classes for teaching, having posters up and having things such as posters or signs with different languages, so that even different cultures, whether it be the nurse or the family or any visitors that you have, everyone can see it and read it and adhere to the protocols for preventing the spread of MRSA. Enforcement of adherence to hand hygiene and contact precautions. So hand hygiene is the primary strategy to reduce health-acquired infections and prevent transmission, and this particularly is also for MRSA. So the pictures down here, this is 6 seconds of washing without any soap, it's just water. So as you can see, there's a whole bunch of germs and different kinds of stuff on her hands. This one's 6 seconds with soap and water, but you can see there's still some stuff around her fingers. And this is 30 seconds with soap and water. So just 30 seconds of washing can really cut down on the amount of germs on your hands. So that's a big one. Increasing the number of sinks on the unit, as well as placing sinks in very obvious places. So some nurses found that if you had sinks in more obvious places, that you wouldn't be able to ignore them, and they would be more frequent throughout the unit, that maybe you would be more reminded to wash your hands. Washcloths, if you're doing bed baths, use one washcloth for every body area, and don't reuse or don't re-put them in the water after you've washed. They also found that daily chlorhexidine glutamate baths significantly reduce the amount of MRSA infections, so those can help. And get rid of bath basins, because 98% of bath basins have bacterial growth in them. And then compliance with nasal swabbing, so that's to make sure that no MRSA goes undetected, even if they have it or they don't have it. So how nurses should incorporate findings and recommendations that we went over into their practice. Use and recommend chlorhexidine glutamate for baths. It was 95% effective in reducing the transmission of MRSA. So if your hospital doesn't carry them or they're not on your unit, suggest to your supervisor to maybe add them into your routine. You can either do the bag bath, which is 2%, or they have soap for 4%. Also try to refrain from using bath basins, as they populate bacteria. Regardless of time crunch schedules, continue to practice good isolation and precaution. So always put on your PPE, and if for nothing else to not spread it, protect yourself from MRSA and protect it from going home and giving it to your family as well. Incorporate use of personal protective equipment, but find other ways to make the patient feel comfortable. So you can still stay in their room, have a conversation with them. You don't need to be in and out. You can't really have the personal touch, but there are other ways that you can help them feel comfortable. Be sure to disinfect all your equipment. So again, wipe down everything with Clorox or some sort of disinfectant of things that you're taking into the room and things you're going to be taking out of the room. If assigned a patient with MRSA and you also have a patient that is immunocompromised, make sure you say something. You don't want to get somebody else sick, and it's just easier for you as well. Double check charts for new admissions. So when new admissions are coming in, making sure you're double checking their charts to see if they have a MRSA infection, because if somebody doesn't tell you and you don't know, and then you walk into their room and walk into somebody else's room, you're going to spread it. So just make sure that when who have a new admission, make sure you check for a MRSA infection. Advocate for signs and other teaching material in your unit. So make sure that you have signs reminding people to wash their hands. If you want particular signs for patients that have MRSA, to put reminders in their room, you can do that. If you can also educate patients, families, and visitors on MRSA, so you can take it upon yourself to do patient education for not just the patient, but for families as well, so that they know how to keep themselves from getting it, and as well as spreading it throughout the unit. And finally, hand hygiene compliance is the #1 biggest thing to do to prevent the transmission of MRSA.